How are you today? Happy New Year.
Happy New Year. I think 2023 is going to be an amazingly fertile year. I think 2022 was tough. Lots of people became pregnant, but there were disappointments. And
Yeah.
the first thing I would say about 2023 is my favorite day of the year is New Year's Day. Because
Why so?
Everything changes. Everything is different. And everyone who's trying to become pregnant should forget about the past. Forget about it. Start over. Because for many people, the beginning of a year is sad because they feel like we failed last year, we're going to fail again this year, but that's not how we should view things. I think you should really look carefully about what you're doing, why you're doing it, and whoever it is you're working with, you should go to them and say, maybe we're in a rut. Maybe what we're doing is not really working. Let's think this through. Let's see if there's something different we can do. Already doing new things this year. I'm sure you're doing new things. So we want everybody who's watching today, we want everyone to become pregnant this year. And so I hope that we all turn the page on last year and see if there's something else that can be done to help everybody here today.
Yeah, I love that thought of really turning the page on last year and forgetting about whatever disappointments were there and whatever struggles were there, and really trying to start off on a fresh new foot and moving forward in this new year. It is just, for all intents and purposes, an arbitrary day on the calendar that we tend to celebrate as the new year, but we can use that in a positive way if we want to as well, and being able to take that arbitrary day and say to ourselves, okay, so what are we going to do to make this year different, and how are we going to learn from last year? One of the biggest fortunate things we have is being able to learn from our mistakes. So what are we going to learn from whatever mistakes were achieved in the previous year, and how are we going to build upon that to move forward and grow and achieve our goals in this year? And I think that's really such an important concept and thought process that needs to happen. So I think that's a wonderful first step in this conversation about how to approach 2023 to get pregnant. I did, before you were joining, Dr. Wood, I asked everyone if they had questions to go ahead and post them. So the best place to post them is in that little question mark box in the bottom right-hand corner for us to see. And we'll do our best to get to those in a little bit. Now, you had said that you're already doing some things new in this new year. We're just a couple of weeks in. What's new that you're doing already?
Well, the first thing I want to say is one of the things that you're doing I really like, and I'm very interested in it, and that's the red light therapy.
Yeah.
And I've actually had, just since the new year started, multiple patients ask me about that. And I say, I know the guy that's doing this. So I'm going to be very interested to see how that works out. And what's one new thing? We're doing several new things, but one of them is Neupogen, which is a medication that's used to rebuild red blood cells after chemotherapy, but it turns out it also seems to make the lining much stickier. And we're starting a new protocol where we actually infuse Neupogen into the uterus to enhance the stickiness, so to speak, of the uterus. And we're doing that 2 days before we do the embryo transfer. So this is for very difficult patients that have not gotten pregnant when they should have. Every time we do an embryo transfer, we think, is this someone who should get pregnant or not? And I want everybody that should get pregnant to get pregnant. And I want some of those that shouldn't get pregnant to get pregnant as well. But there's certain people, they just don't get pregnant, and it's not clear why. They have a normal uterus, the transfer goes beautifully, but they don't get pregnant. So this is one of the things that we're trying for this year. We don't have that many patients that didn't get pregnant when they should have, but we do have some. And so I'm very excited to try this new protocol. And we have several other things that we're going to do too. But that's one of the things that I do every year. I have new things that we begin to do when the new year starts, because you and I want everyone to succeed, everyone. And we know that some people, I'm sure you have patients that you know should succeed, but they're not. But that's a 2022 thing. 2023, we're going to take care of that.
I love that. I love that. Yeah, I think that's really fascinating in using Neupogen a little bit differently than you have in the past. I think that's interesting. I'll be following along to see how that goes. For all of you watching right now and you're starting this new year fresh, we often talk about New Year's resolutions and how we're going to approach things. What are we going to do at the start of the new year to be better in the new year than we were last year?
Yes.
I think if we have, I think one of the first things I'd like all of you to think about when we're making those decisions and trying to come up with that list is to keep it simple and straightforward and have goals that are doable and accomplishable for you all as well. So if that is that you could be doing better with exercise or with diet or with meditation, that you're going to be more proactive about seeking out the care that you deserve and need for your fertility. These are all simple things that are achievable that I think are really important that we use as a foundational piece to build upon. So that way, when you go in and see someone like Dr. Wood and he says, well, we're going to try this new technique, or I say we want to try the red light therapy in addition to the acupuncture and so forth, that we're building onto a strong foundation that you've already laid for yourself. And I think that's really important because those are not things that either one of us can do for you. You all have to do those things for yourselves. We can help guide, but you all have to really follow through with those. And then we can build upon that to really be successful in this new year. Let me see here. We've got some questions that came in. So someone was it was more of a general question about adenomyosis and asking, saying I had multiple failed cycles. And, they didn't really ask a question, but it was more about, just trying to get additional help for adenomyosis.
Well, adenomyosis is a condition in which the lining of the uterus grows into the wall, grows into the muscle. Adeno means glands and myo means muscle. It is very controversial. I think the most important thing to remember is that everyone has it. If you've ever had a baby, if you've ever had a DNC, if you've ever had any uterine procedure, you already have adenomyosis. And obviously, women who have had 5, 6, 7 babies are actually much more likely to get pregnant again. So there are many of us that are not big believers that adenomyosis is a big deal. However, I'm aware that if someone repetitively fails, if a fertility specialist cannot help them become pregnant, they will blame adenomyosis. I cannot tell you the number of patients I've had that came in and I said, why aren't you getting pregnant? I always ask that because many times the patient has an understanding that you don't realize. And so many times they've said to me, oh, it's adenomyosis. But then when you do things right, when you do things well, they do become pregnant. So I'm not a big believer that adenomyosis is a major cause of infertility, with a few exceptions. There are some women that have what are called adenomyomas. And these are areas, circumscribed areas that are quite large that contain these adenomyomas. And there may be an effect there. But otherwise, I've never really seen that as something that stops someone from becoming pregnant when you take care of whatever else is involved.
Beautiful. So again, that wasn't really a question, but at least we have a little bit of perspective on that. And I imagine that perspective is probably a little bit different than what others have probably heard in the past when it comes to adenomyosis. So it's good for us to have different perspectives on our individual needs and circumstances, because it gives us a better understanding and broader understanding of what's going on, and allows you to think a little bit differently about ways that can support or how you can address those things so that you can make the best decision for yourself. So I always love that. Is there does your office have some sort of like new thing that in terms of how they communicate with patients in the new year, or, not necessarily procedure, but like more thought process wise?
It's something that we're working on a lot, because what happens is a patient comes in and they have questions, and I hope the staff is very good at answering those questions. But you know what it's like. The minute you hit the car, the minute you head down the hill, you have more questions. And so now they have ways of texting to get instant or near instant information. And one of the things I feel so lucky about is that the staff, they answer questions all evening. Some cases, they tell me they get texts at 2 or 3 in the morning, and they answer those questions.
Wow.
So I love that. But I'll tell you something else that we've done recently. We've had a number of patients that came in, and they had only been trying for 2, 3, 4 months. In some cases, they were about to try, and they said, we want to make sure everything is okay now before we do that. And I love that. So we've developed this new kind of mini pre-fertility kind of testing that we do that look at the major causes of infertility, including doing a semen analysis, doing kind of a mini semen analysis, and making sure that ovulation has happened, make sure that egg quality is good and egg number is good. We look at the history. We make sure there's nothing obvious there that might cause infertility. I think it's so smart, because I think back on so many patients over the years that have not gotten pregnant for year after year after year, but they never saw anybody. They never really thought about, why am I not getting pregnant? And whatever else you say about fertility, it gets worse with time. So I think it makes a lot of sense to find out why it is that you're not getting pregnant, or if you haven't even started trying yet, to make sure that everything is as it should be. And I'll tell you what's interesting about these patients. Every single one of them has gotten pregnant. In most cases, without any treatment. Because we were able to give them advice on what to do to enhance the chance of pregnancy. And I know that that's something that you do, and I think that's really, really valuable. So I don't think patients should wait months, years to find out what's going on. Find out what's going on. Find out what could be done about it. Take care of it and get it done while you're younger than whenever you would have come in to be seen later.
Yeah, it's such an important piece. I admire those couples that are being proactive sooner on their journeys. They just want to make sure that they have all their boxes checked and they're doing all the right things and moving in the right direction and getting as much information as they can so they can get pregnant, like you mentioned, quickly, which I think is amazing. But that piece of being proactive sooner for ourselves, I think, is really an important piece, because we're often told, we often read or hear these guidelines of 6 months, a year, or whatever it might be. And even though those are guidelines, and even though if you reach out to your OBGYN, they might use those guidelines and say that there's not much they can do for you, it doesn't mean that there's not something you can do, and that there's not clinics or individuals like ourselves who can work with you to be proactive now, to make sure all of those foundational areas are being addressed, so that you can be more, so that you can get those successes sooner rather than later, and not have to wait and be frustrated by that whole waiting piece. So I think that's a really important piece as we're talking about how to approach the new year and what are we going to do differently in 2023. I think this piece of really taking control of that process, and really being proactive about seeking out the care, attention, and knowledge that you deserve to have, so that you can make those sound decisions about what you're going to do with your fertility or how you're going to move forward.
Yes.
I think that's a really, really important piece that so many watching right now can do, and it's relatively simple. There's so much information and resources out there that you can be more proactive now, and you don't have to follow those guidelines and kind of just sit back and not do anything about it. So I love to hear that they're doing that, and I would love to encourage those listening to do a little bit more about that as well.
let me say, one other thing. I told you that whenever someone comes in, I say, "Why aren't you getting pregnant?" And most of the time they laugh and say, "Well, that's your job to tell me." Of course, I want to know what they think. But what's so strange to me is that many of these patients have already had significant treatment, in some cases multiple IVF cycles, and yet they don't know why they're not getting pregnant. So
Yeah.
I think one bit of advice for the new year is make sure you understand why you're not. And if it is unexplained, that's important too, because unexplained infertility tells you the kinds of things you can do to overcome that. But if you really have no idea why, that's not good. That does not give you the greatest chance of success.
Yeah, that example is a common one that we hear. I've had multiple IVF cycles or IUIs. We've been trying for a year or two, and we don't know why we can't get pregnant. I agree with you. Those are things that we want answers to. We really want to look to have a better understanding as to why. We all deserve to have those answers. And so if that hasn't been figured out, I think that's really an important piece as part of that process as well. Someone did ask, I'm fairly certain I know your answer to this, but someone did ask, should an HSG be part of a pre-fertility workup?
It depends on the history. So I mentioned we do a history as well as that testing. And HSG hurts. It's uncomfortable. I think you need a good reason to do it. And I wouldn't normally do it as part of a pre-fertility testing unless there's a good reason. Some women have had chlamydia, they've had gonorrhea, they've had pelvic inflammatory disease, they've had a ruptured appendix. There's a variety of things that they've had that would tell you it's something to consider. I would never push it, but if they had one of those things, I would say, this is a potential option for you. But I hate sending women to get that test without a very good reason. But if there's a good reason, I think it's important. You also look at the age of the patient. If a woman is, let's say, 31 years old and she has excellent hormone values, I would certainly wait. So we give them the option if there's good reason to do it. But otherwise, that was a very wise question on the part of that viewer. We don't push it at the beginning. It's just an uncomfortable test you need a good reason to do.
Hannah asks, I don't want IVF at this moment. What would help me get pregnant now? And so, that's a broad, big question, so to speak. But the reality is a lot of what we do on the natural side could really be beneficial. Adding in the acupuncture, we mentioned the red light therapy potentially, but also those areas that I mentioned earlier to kind of set that foundation to make our jobs easier. So making sure that you're taking care of yourself, that you're eating a good solid diet. This is the time. You've all had all those sweets and all those tasty foods and probably a bunch of alcohol during the holidays and so forth. Now's the time to reset from that and start eating a little bit simpler, cleaner, healthier, get rid of that alcohol, a lot of fresh foods, whole foods, and getting out and exercising, even if it's a little bit chilly, or wet at times, as we've been having recently. Get out and move and exercise. Make sure you're getting plenty of rest, good amount of sleep every night. These foundational basic things are going to be really important and really impactful in your fertility moving forward. And so I would focus on some of those things, and then find someone who can help you with some additional natural treatments, who can evaluate your case, put you on some good supplements and some acupuncture and so forth. And I think that's a wonderful way to start off before you ever get to IVF if you're not ready for something like that.
I think something that people don't think about is that most causes of infertility are relative. They reduce the chance of success. They don't eliminate it. Now, obviously, if your partner has zero sperm or your tubes are completely blocked, that's different. But for the vast majority of couples, they have some chance of getting pregnant. And if they can do things like you just mentioned to increase the per cycle chance of becoming pregnant, That's a wonderful thing to do. And many of those things you mentioned are relatively straightforward to do. And they're things that the couple should do to give themselves the greatest possible per cycle chance of becoming pregnant.
Yeah, you said it beautifully. I love that sentiment. Here's a beautiful question, and for whatever reason, this topic has come up a couple of times. Not in this live, but recently in the last week. This person had a recent retrieval cycle that resulted in an empty follicle, and they're wondering potentially why that may have happened or what they could do differently in the future to prevent that from happening.
You know, it's a great question. We do a lot. we do a lot of those types of cycles. We have many cycles with 1 or 2 eggs. And it matters a great deal to me to get that egg. It does. And we run around 90% recovery. Occasionally, you're not going to get an egg. Why is that true? You know, a lot of it has to do with the cycle. It has to do with triggering ovulation at the right time. We all have little tricks we use. I go into the follicle 20%. You know, I have things that I do. I flush a certain number of times. There's studies that have looked at how many times you flush and the chance of getting an egg. But I'll tell you one of the most valuable things we do. When the first fluid comes out of the follicle, the embryologist looks at it. And if there are no cells there, no cells, you're not going to get an egg, because an egg has millions of supporting cells around it. So our goal is to get an egg from every follicle that has cells. I know it's incredibly frustrating not to get an egg. When it happens to me, it's incredibly frustrating. But the fact is, you should get an egg virtually every time if there's an egg there. Everything needs to be done right. The cycle needs to be done right. The retrieval needs to be done right. It needs to be on the right day. It's like many things in life. If you do everything right, you have a much greater chance of succeeding in whatever your goal is.
Yeah, absolutely. You know, but it's interesting that for whatever reason that topic has come up multiple times for me, at least in the new year. I don't know why. Hopefully that doesn't mean we're going to have a lot of empty follicles in the future of 2023. So, you know, as we wrap up here today, Dr. Wood, is there any last thoughts on that you want to share for everyone listening about approaching the new year and making 2023 the year that they have the child of their dreams?
You know, I know people say I'm an optimist, but I really believe that virtually everybody can become pregnant. Whether or not you do become pregnant depends on the choices that you make. And I think the things that you've mentioned today, the things I've mentioned, when you do them together, your chance is going to be much higher. I don't think you should be down about the past. As I said, let the past go. Let's do the best we can possibly do in this next year, knowing that you almost certainly have a chance. Let's do everything we can to increase the chance that you succeed this year so that you're not here next year. You're not here in early January of 2024. You're already pregnant. You're too busy taking care of your baby to watch this next year. That would make me very happy.
All of us, I think, really. That's a beautiful sentiment. I think a beautiful one to leave on, that we want all of you to get the results that you deserve and want, and we'd love for you to have that in this coming year. And hopefully a little bit of those suggestions that we talked about today, you know, can help move you in that direction in this year. But, you know, certainly please know that Dr. Wood and I are here for you. If you've got questions, need to reach out to us to see how we can support you. You could do that through either one of our profiles here on Instagram as well. So wishing you all a successful 2023 and lots of babies to come. Thank you, Dr. Wood, again for joining me tonight. I appreciate it.
Good night, everyone.